Welcome to AK classes.
Thank you for waiting. I've just examined your son, and he has a severe case of nappy rash. It's a common condition and not a cause for major concern, but I understand it can be quite distressing.
I can't believe it's just a rash. He's been crying so much more than usual, and he's having trouble sleeping. I think it must be something more serious.
I understand your concern. Nappy rash can indeed be very uncomfortable for babies, which might explain the increased crying and difficulty sleeping. However, since it's confined to his buttocks and there are no other symptoms like fever, it does seem like a severe case of nappy rash. Young babies can also cry more due to teething or colic, which are also common at this age.
I didn't realize nappy rash could be this severe. I'm glad it isn't something else more serious.
Yes, it can be quite severe at times. Can you tell me about your routine for changing his nappy? How often do you change him, and what kind of nappies do you use?
I change him every few hours. We use disposable nappies, and I use scented soap and baby wipes every time I change him.
Thank you for that information. Using scented soap and baby wipes can sometimes irritate a baby's sensitive skin, especially during a nappy rash. Have you tried any treatments for the rash so far?
We've tried over-the-counter antiseptic creams which work temporarily, and we also give him paracetamol for the pain.
Those are good initial steps. For a more effective approach, I recommend using unscented, alcohol-free baby wipes or even just plain water with a soft cloth. Also, try to avoid scented soaps and switch to a gentle, fragrance-free cleanser. Applying a barrier cream with zinc oxide after every change can help protect the skin. Additionally, allowing your baby some time without a nappy each day can help the skin breathe and heal faster.
That sounds really useful. I'll follow that advice.
Great. Also, make sure his nappies fit properly and aren't too tight. Sometimes a tight nappy can cause additional friction and worsen the rash. How long has the rash been persistent?
It's been about a week now. We thought it would clear up on its own, but it hasn't improved much.
Given that it's been a week, it's good that you came in. Persistent nappy rash can sometimes develop into a secondary infection if not properly treated. Are you noticing any other symptoms like an unusual odor, yellowish crusts, or pus?
No, nothing like that. It's just very red and seems painful.
That's somewhat reassuring. Since it doesn't seem infected, we can continue with the current plan. Besides the barrier creams and avoiding scented products, make sure to change his nappies more frequently than usual, even if they don't seem very wet. Keeping the area dry is the key.
I see. I'll make sure to change him more often and use the unscented products.
One more thing, try giving him some nappy-free time throughout the day. Lay him on a towel and let the air get to his skin. This can significantly help in the healing process.
That makes sense. I'll definitely do that.
Excellent. If you don't see any improvement in a few days, or if it gets worse, please come back. We might need to explore other treatments or check for a possible yeast infection, which sometimes requires a different approach.
Okay, I'll keep an eye on it. Thank you so much for all the advice. It's been really helpful.
You're welcome. It's always a bit challenging with little ones, but you're doing a great job. Just keep up with these steps, and he should start feeling better soon.
Thanks again. I'll get started on these changes right away.
Take care, and don't hesitate to reach out if you have any more questions or concerns.
Will do. Have a good day.
You too. Goodbye.